The honourable member for Cape Breton Centre.
Mr. Speaker, in the last 5 years, the number of patients visiting emergency rooms who don't have a family doctor has doubled. Mr. Speaker, we know the numbers at the Halifax Infirmary, but what about our other hospitals? Surely, if there are this many people in Halifax ERs, they must be showing up elsewhere as well. Mr. Speaker, I'd like to ask the Minister of Health, can he tell this House how many patients across Nova Scotia are winding up in emergency rooms because they do not have a family doctor?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. It's no secret, Mr. Speaker, that there are many Nova Scotians looking for access to primary care services in their communities. That's why we commit to a number of initiatives, Mr. Speaker, to help encourage the recruitment and retention of family physicians, Mr. Speaker, but also other healthcare professionals to join the teams with the family physicians to provide primary care access, to improve that access within our communities, Mr. Speaker. It's important to know that the emergency services that are available within the province, Mr. Speaker, provide care when needed, but major priority, Mr. Speaker, around primary care is, of course, strengthening the teams we have and expanding our teams across the province. Thank you.
The honourable member for Cape Breton Centre.
Mr. Speaker, we know that Halifax isn't the only place where Nova Scotians have no choice but to turn to emergency rooms for primary care. We should not have a situation where people who need to see a regular family doctor wind up in hospital beds. But we do have that situation, Mr. Speaker, and because of this, we have terrible things happening. We have grown children watching elderly parents take their last breaths in crowded hospital corridors. Mr. Speaker, I've asked this and I'll ask again. Does the Minister of Health share our outrage at the state of healthcare in this province?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I've never shied away from recognizing that there are challenges in our healthcare system, Mr. Speaker. What we've recognized is the need to do more. That's why we continue to invest in expanding our primary care services, Mr. Speaker. We're working with, just last week, Mr. Speaker, a new program to help encourage the recruitment of international physicians to Nova Scotia. It's something that was done in partnership with my colleague, the Minister of Immigration. Mr. Speaker, we expand the tuition relief program, Mr. Speaker, and other incentives to—
Order, please. The Honourable Minister of Health.
Tuition relief, Mr. Speaker, and other incentives, make them available to physicians across the province, Mr. Speaker, not limited to just some communities. And, Mr. Speaker, in addition to that, we plan to expanding our residency—
Order, please. The Honourable Minister of Health.
Our residency programs and collaborative care practice, Mr. Speaker, all in an effort to improve primary care access to communities across the province for all Nova Scotians. Thank you.